Hello, everyone, and welcome back to our October edition of our infection control podcast. I'm Fran, one of the infection control nurses.
Hi everyone, thanks for joining us. I'm Jen, one of the other infection control nurses.
So today we're going to be covering again another favourite topic of everyone is winter preparedness, because although we don't necessarily like to admit it, winter is coming. So
I'm not entirely sure we've ever really not been in a winter
I was
preparedness
gonna say,
situation. It feels like we just need to gear up for what
yeah,
is already happening.
yeah,
There might just be a
exactly.
bit more.
Yeah, exactly. And we're just kind of reiterating, just emphasizing again stuff that you probably already know, but it's just, again, just to bring it back to the forefront, just so we can make sure that we're prepared as much as we can be and that we're protecting ourselves and our patients. So, Jen, I mean, in terms of winter illnesses, what are we, potentially looking at expecting?
So normally everything's gone a bit out of kilter with COVID when we could nearly always sort of predict when our seasons were going to start, when flu season was going to start, when our delightful norovirus season starts. It's all got quite confused and it's now a little bit more unpredictable.
Mhm.
We know that there will be an increase in respiratory viruses as the weather gets colder.
Yeah.
We know that there will likely be more diarrhea and vomiting
Mhm.
outbreaks
Yeah.
within the community, which will then likely come into the hospital.
Yeah.
Normally that saves itself for sort of late winter, sort
Mhm.
of February, but
Yeah.
we'll just have to wait and see what
This could be any
happens.
time, really. Yeah.
Obviously, some of our respiratory viruses can give people some enteric symptoms.
Yeah.
So it's then sometimes a bit of a lottery of which one am I dealing
Exactly.
with today.
Absolutely.
And it might be both, who knows?
Yeah. Lucky us. So, I mean, in terms of on the wards, if you've got any patients that have had started to have onset of diarrhea and vomiting, then there are just a couple of things that we need to make sure that we are doing to help minimise the spread of DMV illnesses. So anything that is unexplained, where a patient is not on any antibiotics, they don't have any history of diarrhea and vomiting, it's not a norm for them, then we need to isolate them in a single room. We need to send a sample as soon as we can, and we need to inform, obviously, infection control as well, just so we can kind of follow up on that. And if it's out of hours, then you can contact the on-call microbiologist via the usual routes for switchboard, and just via the trust procedure. But also starting a DMV monitoring sheet is really, really helpful for us, and also for you, just so you can kind of see, the progression, or if it actually is a communicable illness, whether it's actually spreading across the ward. But I think just just emphasising that all of those steps need to be taken as soon as possible,
Yeah,
to
and
minimise.
absolutely. I think sort of from our point of view, almost the most important part is isolating the patient and sending the sample.
Yeah.
Until we have a sample, we don't know what we're working with.
Yeah.
When you're sending it off, often the lab won't process it because it has to be requested by a microbiologist or us as the IPC team to request that norovirus testing.
Yeah.
But just give us a shout because we can contact the lab and ask them to test it.
Yeah.
Once we've got maybe 1 or 2 positives, they then won't do any more testing because we know what we're working with at that stage. And yeah, like Fran mentioned, the DMV monitoring sheet is really helpful because sometimes you can sort of think, oh my goodness, is this an outbreak
Yeah.
that's happening? And actually we can come through, we can go through every patient, and it might actually just be a bit of a coincidence that due to their clinical condition or due to any medications that they've been having, they've developed a bit of diarrhea and or vomiting.
Absolutely.
I think any unexplained diarrhea, any diarrhea at all, absolutely just send a sample straight away. It doesn't,
Definitely.
we wouldn't expect patients on laxatives to develop diarrhea as a result of those laxatives.
Yeah.
There are obviously exceptions to that, but any issues with any patients with diarrhea, please send a sample.
Yeah. And also remembering that you can send a sample, mixed with urine from bedpans,
From a pad.
pads.
Yeah.
Yeah. Just so
Even
we
off the
can,
floor.
if you have to get it off the floor, you get it off the floor. So just do what you can.
Do what you can to get a
do what you
sample.
need
We
to
don't
do.
care where it comes from.
Yeah, we just need a little bit. And then obviously going on to another, as Jen sort of mentioned earlier, our respiratory illnesses. So we know that these are things like COVID and influenza, and there are a number of other things like RSV, rhinovirus, etc., that can be seen as part of all the respiratory illnesses you might get over winter. So again, in terms of precautions, if a patient has symptoms of respiratory viruses like a high temperature, a cough, then again your first question would be, could this be a respiratory virus? So your first and probably the most important step is isolating that patient. No matter what, no matter if you've taken a swab or not, they need to be isolated in a side room.
Not waiting for the results before
Yes,
isolating.
exactly.
I know it's a pain, and I
Yeah.
know that we have such limited isolation facilities,
Yeah.
but if you don't want it to spread,
Yeah.
contain it
Yes, exactly.
and shut the door.
Shut the door, yeah.
There's
Please
no
keep the door
point in
shut.
being in a side room if the door's open, by the way.
Exactly, absolutely. And then your second step would be, assessing whether they are eligible for COVID antiviral treatment. And if they are, then you would need to complete a PCR test, not an LFD, a PCR test. All of the medical conditions that may make you eligible for COVID antiviral treatment are on the intranet, on our action card. What
It's
number,
Action
sorry?
Card 1. It's the guidance for testing. I mean,
Absolutely.
very sort of simply put, it's most cancers, any sort of solid organ transplants, the progressed renal disease,
Yeah.
quite a few neurological conditions, and some blood disorders.
Yeah.
But there's a much more extensive list on the Guidance for Testing Action Card,
Yeah.
which is number 1, so it's nice
Number
and easy
one.
to find.
But also considering that if they are not going to meet this criteria, then they do not need to be swabbed for COVID, and they just need to be isolated until their symptoms resolve. So we would say, as usual, sort of 5 days of isolation, making sure they've been free of a temperature for 48 hours, and just feeling well,
Yeah.
no new oxygen requirements, etc.
Making some progress
yeah.
towards like respiratory recovery.
Yeah, absolutely. And then I think the third step that we can mention is that if they are COVID negative, if you're testing them because they're eligible for antiviral treatment, that you may want to consider a respiratory panel if they are negative for COVID. If there are any other instances in which you might want to do a respiratory panel, then I suppose by all means.
Yeah, I think, and that would definitely be one to discuss with the sort of wider MDT as well, just to consider, because the full respiratory panel testing is only done twice a week in the lab. It's done on a Tuesday and a Thursday.
Tuesday, Thursday, yeah.
Tuesday, Thursday.
Yeah, that's the one.
But you can get some lessened respiratory panel testing that is done daily, but it would give you much less in the way of respiratory viruses. I think it tests for influenza A, influenza B, RSV, and COVID.
Yes.
So it's very, very worthwhile, but it's just, you need to consider which one is the most appropriate.
Absolutely, yeah.
So another part of sort of us, we want to do this all the time, but definitely coming into winter, is the isolation posters that we display on the outside of side rooms. Have you got enough?
Yeah.
Have you got any?
Yeah.
And are you using them correctly? So we're wanting the red isolation posters to be used for any respiratory viruses, COVID, flu, whatever you like. Because by using the appropriate one, it's telling other staff and it's telling including sort of our domestic services, what clean needs to take place and what PPE needs to be worn in order to be able to enter that room.
Yeah.
So red is for respiratory viruses, yellow is for your more sort of standard precautions isolation, such as a patient with C. diff or MRSA, and blue is protective isolation if we're wanting to just be mindful of any patients who are neutropenic, to make sure that we are protecting them from us.
Yeah.
Now, to order these, it might be worthwhile doing it divisionally, but if you want to do it by ward, then crack on. The order codes are actually at the bottom right-hand corner of each poster, and they can be ordered directly from Colour Connection. So we've got all of the order codes are out on the latest newsletter.
Yeah, and hopefully we should be updating the internet page soon, because we have got the old codes currently.
Yeah.
But just so we can...
We have also got them on the Microsoft Teams Link practitioner account, and
Yeah.
they are viewable on there.
Yes, yeah, definitely.
They're just, like I said, really helpful as a prompt for what PPE do I need to wear, and for our domestic services teams, what clean needs to take place in that room. I think not necessarily looking or relying on what the person before you is doing. You need to make sure that you're sort of following the thing that's going to keep you safest and keep your patients safest.
Yeah, we do see a lot of the old infection control posters around. So if you're not sure what the new ones look like, there are plenty of places that do have them, and I think there may be some pictures of them on the internet somewhere.
Yeah.
So it's just for a little refresher, just to remind yourself of which ones are the newest ones, and then hopefully we'll all be able to be in line with all of the posters that we have eventually. But yeah, as Jen said, they're really good for just that reminder before you go in, because I know that, I mean, when I've been round, sometimes I've like looked at a poster, I'm like, oh, what is it? Like, do they have anything? You know, anything
definitely.
like
I've
that.
done the same. You're sort of looking on the outside of a door for,
Yeah.
do I need to put any PPE on before going in to visit this patient?
Yeah, exactly. Yeah. So the third part of sort of winter preparedness, and again, I know a big fan favourite is looking at the seasonal vaccination programme. So as health and social care workers, we are recognised as being a priority group for both COVID and influenza vaccinations, because we're most likely to be exposed to influenza and COVID-19 viruses. So I'm sure, as some people may be aware, the vaccination program started earlier on this week, and they're currently administering COVID vaccines, and they are bookable on the internet. And then the influenza vaccines will be available from the 2nd of October. So again, the vaccination team have their booking page on the intranet. I think it was on some of the comms, and they also have a roving team which go around on nights, weekends, twilight shifts, just to make sure, you know, everyone who wants to have their jab is having it.
Yeah, and those who might not be able to necessarily leave the clinical area to be able to receive it.
Yeah.
And it's also, it's a bit more convenient if they're
Yeah,
coming to your place of work.
Yeah,
I had my COVID vaccination yesterday.
Me too.
So, and yeah, I've got my flu one booked in for the beginning of October.
Yeah, absolutely.
But no, I mean, it's a really important way that we can protect ourselves, protect our family, and protect our patients.
Yeah.
It does, you know, just some sort of myth busting. The vaccinations do not give you that illness. They allow your immune system to be exposed to a small amount of inactivated virus so that you can build up that immune response and develop those antibodies to be able to fight the infection if your immune system encounters it again. And it's the sort of the live version, if you like.
Yeah, exactly. And obviously, when you go to see those staff members that are giving the vaccinations, they will brief you on any side effects that you may experience. Again, that is not an absolute necessity that you might experience side effects. I mean, you know, feel all right today. So obviously, it's just the norm. Everyone,
like,
we've all
you know,
had
a
our
slightly
vaccines,
aching
so
arm and so on.
Yeah.
But yeah, other than that, if anything, if you do actually feel like a tiny bit under the weather, it's almost not a bad thing, because it shows that your immune system's doing something with that vaccination,
100%.
which is a cheerful thought.
Yeah. But yeah, we would really encourage you to have both your vaccinations if possible, but just discuss with the vaccination team if you have any queries, obviously.
And yeah, it's super easy to book on the internet as well.
Very easy.
And I think I overheard the team saying yesterday, you can book like 5 minutes before your appointment.
Yeah.
So if you suddenly think, oh, I've actually got a few minutes spare, if there's appointments available, you can book just go straight down.
Yeah.
So in Gloucester, it's at Redwood Education Centre in the conservatory, and at Cheltenham, it's in St Luke's Wing, sort of next to cardiac ward.
Opposite DCC.
And opposite DCC, that's it.
Yes. So moving on to, again, our next topic. So just based on the precautions that we need to be taking, so we're going to be obviously looking at our personal protective equipment, or PPE, if you will, and, you know, and making sure that we've got enough of a supply of it, because we don't want to be caught short.
No, last thing you want is, like, on a Friday afternoon, you suddenly are under the threat of a COVID outbreak or a DMV outbreak, and the last thing you want is to open the store cupboard and realise that you're out of masks or out of aprons.
Yeah.
Now, obviously, this is monitored by our materials management team, but it's something that you should probably have a little bit of oversight on.
just a little bit. If you
Just
notice you've got one box left, just
yeah,
see
maybe
if they're any coming.
yeah, give them a bell.
Yeah.
And yeah, just to make sure that you've got a good supply of PPE in your area, making sure that you've got your FFP3 masks and visors for if you're caring for any COVID suspected or COVID confirmed patients.
Absolutely. I know that in a couple of areas that I've been to, there's all from what I've seen, there seems to be a good availability of masks, but visors is something that I don't see around that much. And just remembering that if you're going to be going in to see a patient who is confirmed COVID or suspected COVID virus, then you need to be wearing your visors as well as your other respiratory precautions.
Your eyes are another mucous membrane, guys.
Exactly.
The virus can jump straight in there, and then boom, it's in.
Yeah, there we go. And that's that. So yeah, just making sure you're on top of that. Maybe doing weekly checks and ordering anything if you need it. And obviously, if it comes to that you don't need it, then at least you've got your supply there just in case.
Not that we're encouraging hoarding.
No.
So the final sort of topic that we wanted to cover, looking at winter preparedness, was fit testing. Now, our colleague Kath has sent out an email quite recently with how to secure supplies. They're going to be available from procurement. We currently don't have any supplies as the IPC team. I think we have the odd bottle of solution here and there that we can happily give to you if you're in a situation where you don't have any. But looking forward, it's going to be you need to order them from procurement. We need to make sure that staff are fit tested so that we know that, so that they know and we know that they're using the most appropriate respiratory precautions. Fit testing needs to be done 2 yearly, or if there's been any sort of dramatic change to your face shape. If you've, lost weight, gained weight, whatever, you might just need to consider, do I need to be refit tested, just to make sure that those masks are providing that adequate level of respiratory protection.
Yeah, so I think that was everything.
Bright and breezy today.
Preparedness.
A short one.
Yeah, we just wanted to make sure we got everything in, and making sure that we're all going to be safe and protected and well over the winter period, and that we can enjoy it as much as we can outside of work as well. So just a couple of other things from us, really. So our most recent newsletter has just come out, which is for September. It spans the period of September to December because it is quarterly. So we have sent that out via email, but if you're interested and you would like to have a look at it, then please just give us an email and we'll be able to send that over to you. It's got some really good information in it. It's got probably a lot of the stuff that we've obviously talked about today in it as well.
And some additional resources.
Yeah, just a couple of bits and pieces. So that's always a good one to have a look at.
Not sure also how you're listening to this, through what platform, but it is available now on YouTube.
Yeah.
We're
branching out.
We are. There's a QR code on the. It will be on the intranet, and it will be. It's also on the newsletter for anyone who has received that or would like to.
Exactly. It just makes it a little bit more accessible. And obviously, it's now kind of in the public domain, as it were. So
please feel free to leave us any comments, any feedback.
Definitely, it's always very much appreciated. So go for it. I guess one other little thing to mention, we do have our infection control study day coming up, which is in 13 days time now. So we've been working very hard to try and make it as good a day as we possibly can, and we're actually really excited for it. It's going to be a really good day. Lots of interesting speakers, lots of exhibitors coming. We've got some great sponsors. We've just got some really exciting things.
And there'll be some nice food. And who doesn't like a free lunch?
Exactly. And it's in a nice place. So, it's going to be really good. So if you are registered to come to our study day, just check out the emails. I did send out an email yesterday with just all the details and some FAQs. So make sure to check that out if you have any questions. Um,
And we look forward to seeing you there.
yeah, we're very excited. That would be really fun. So I think that is everything, unless you can think
I
of
think
anything else,
so.
Fran.
No,
Yeah.
we'll be back next month with another fun edition.
Exactly. So as usual, if you need to contact us, then we are on extension 6122 for Gloucester and 3129 for Cheltenham, and you can contact us via our email address, which is acute ICN in the address book. And yeah, if you've got any questions, just let us know. But yeah, that's it from Jen and I. So we'll be seeing you next month.
Yeah. Thanks for
Right.
listening, everyone.
Bye.
Bye.